Assalamualaikum and hi, my name is Nur Shazila and I will tell you about background our company. We built our private hospital in Johor that known as Harmony Specialist Hospital. Harmony Specialist Hospital was established around December 2004 that are created to serve the medical profession with the affordable, world-class medical treatment. Harmony Specialist Hospital also have 24-hour emergency and trauma center with specialists on duty. Harmony Specialist Hospital already 18 years operated and now provided almost 50 doctors including the specialist doctor. This hospital also provided tons of minor and major surgeries. We also upgraded the latest equipment and facility like inpatient bed, clinical service and the other things. Next, we move to type of management planning. The mission of Harmony Specialist Hospital is the preferred healthcare provider that upgrade hospital facilities to be the best healthcare provider. The main point is around the world. This hospital already expanded throughout this country and will expand abroad in the future. Delivery quality healthcare service is our mission to bring the main focus to our patient. We will provide the best service like comfortable place and room, also the responsible and friendly employee. For standing plan was divided by 3 parts. First part is policy. Policy is a broad in scope like a general guideline for employee. Such as Code of Ethics in Corporate Standard of Ethical Behavior. Next, procedure. Procedure is stepwise guide to carry out routine activity like procedure of registration patient. The third one is rule. Rule gonna be very specific thing like a dress code for every employee while working. There are 3 things for single-use plan. First is program. Program will associated with several projects that need manager to identify the job and task to employees. Example like Harmony Specialist Hospital want to open new branch at Sabah in 5 years. Next is project. Project is the one of the largest of program direct to afford the organization towards the goal project. Example, Harmony Specialist Hospital open new branch in Sabah and need to renovate the building. And lastly is budget. Budget is to quantify the future of organization. Example, the organization will identify the cost to open new branch and renovation building.
Hi and Assalamualaikum. My name is Ainina Almashara binti Rahim. I am going to explain more about organization, that is type of departmentalization. Customer structure is an organization that includes 2%, which is the worker and the customer. So apparently, the managers who is handling the customers knows how to handle the customers well. They also need to serve them based on the customer needs efficiently. On this customer structure, the manager who are dealing with customers are divided by following on their expert parts, such as managers of physical illness will deal with the person who have an illness under the physical type. Then, managers of mental illness will deal with a person who is having a problem like stressing out, anxiety, or even sleep problems, aka insomnia. Finally, the managers of dietary problem will dealing with people who wants to know more about dietary or even a person who have an obesity problem. Next, we have geographic structure. By following the geographic structure of the managers who are involved in the organization of geography has to focus on their departmental areas. This means the managers of every role have a different buildings of each service, such as physical service held at central, mental illness service were placing at southern areas of the company, then service under dietary health are placing at northern. Lastly, a service that conclude mom and children problems is placing at east. This kind of structure helps this company at crowd control so that the progress will not be miserable. From this kind of structure, the most advantageous that we will get is a better interaction with customers that will lead us in having high rated of all. Lastly, we are using network structure under the types of departmentalization. This kind of structure are having an organization that stand in a group of alliances. That means many people will conclude in this structure, or we call it as third-party companies. This may lead us on a wider connection, which is very good because we can get our company known well by the people around the world.
Hi and Assalamualaikum. My name is Siti Sofia Laila binti Zulkifli. For my part, I would like to explain about the focus on decision making Harmony Specialist Hospital. The definition of making Harmony Specialist Hospital is including to find the best action plan and option for the solving any types of issue that may develop business organization. As managers, they must follow the number of the process known as decision making. There are two types of decision making, such as program and non-program. First, I would like to explain about non-program decision making. As we all know, in the year late of 2019, we were overwhelmed as COVID-19 cases virus. As coronavirus continued to spread across every country, Harmony Specialist Hospital are bracing for influx of patients who needs to take care of the most serious effect disease that cause of it. The hospital came under the pressure and readjusted their care priority. So, to solve the problem, Harmony Specialist Hospital has decided to reschedule for the hospital staff from the normal schedule. They were divided into two groups, which is working in 2 weeks of shift, and the aim of the decision was to ensure that the backup staff were available to replace functionally infection to the positive worker. For the program category, Harmony Specialist Hospital that has been structured and a predicted decision that can be handled by a routine approach. For the example, staff schedule. For the doctors, they have to work 14 to 48 hours in a week. A senior doctor has to work more than 12 hours in a day. And lastly, registered nurse of full time has to work 13 to 14 hours in a week. Besides the schedule, dress code also is programmed. A positive professional image to patient and general public, as well to develop pride in our medical center. And is also associates that has to dress all the time when on the duty, including orientation and department meetings.
Hi, Assalamualaikum. My name is Akia Shafiqah binti Raihan, and today I'm going to tell you about the motivation of our company.
Harmony Specialist Hospital has been using Herzberg's two-factor theory of a review of motivation. It is divided by two factors, which is hygiene factor and motivator factor. The elements stated in hygiene factor are salary, job security, supervision, interpersonal relationship, company policies, fringe benefits, and working conditions. For example, from the point of salary element, payments and extra payment or bonus are given monthly to every employee according to their ranks and involvement in the organization. We can also see that the staff of Harmonies could get the job security and work for the longer time, especially when the number of patients increasing daily. Other than that, from the supervision elements, the organization often apply the application of it through discussion regarding to the Harmony's goals and by holding out activities such as company trips in order to motivate them by reducing some burdens from work. Hence, interpersonal relationships among the employees need to be taken care of despite of the ranks, so the miscommunication or any other bad outcomes can be avoided among the staffs. The employees are also offered by some other fringe benefits by being a part of the Harmonies organization members. To conclude the elements of the hygiene factors, working condition is likely to be one of the most important things, since it totally could change the expectation of the outsider, like patients, towards our company, either to a better one or the opposite. In Harmony, the safety, cleanliness, and hygiene can be guaranteed so that it could be ensured the hospital is always in a safe condition and free from crime. There are also motivator factors in this method of motivation that include achievement, recognition, growth, advancement, responsibility, and work itself. For example, from the point of achievement, Harmony has been rewarded in Healthcare Asia Awards in recognition of our 2020 efforts in reducing the socio-economic burden of the COVID-19 for the 2021 Corporate Social Responsibility or SR of the Year in Malaysia. In the elements of recognition of our company, employees are also being celebrated for their recognition during at Harmony's annual dinner. It is to give the opportunity to the employees to whom had sacrificed their hard work and contribution. Next, from the growth of the motivator factors, the staff of Harmony are often being offered a promotional opportunities in the organization. Other than that, the element of advancement based on Harmonies shows that employees are going to be openly advocated by someone in a high position of Harmony who is highly suggested by the main administrator. And for example, all they do is likely to motivate and assist others. Hence, the responsibility are commonly known as one of the important things for anybody in order to ensure that they do feel responsible towards any task they are assigned, and it same goes as Harmony's members of organization. It can't be denied that the main responsibility of Harmony is to furnish the best quality of safety and concern for the patients. For the work itself elements in this factor, we can tell that working in the hospital environment needs lots of hard work, patience and commitment. So do Harmony staff. They might sacrifice anything to ensure any lives could be saved.
Assalamualaikum, my name is Nur Aini binti Muhammad Syarani. Next, I will explain about our leading style that we use to run our private hospital. First, I'll tell you the meaning of leading. Leading means encouraging and judging the group's member to contribute to the goals of the group's objective. Hershey and Blanchard life cycle theories is better suited for us to use in our leadership style when it comes to contingency theories, and this is how these theories work. There is 4 phases in the Hershey and Blanchard life cycle theories. In the first phase is telling or directing, high-centeredness and low people-centeredness, which is the instruction for the follower in the hospital must include the what, how, where, and when of each duty. And this phase, the director who are the one who makes the first decision. In the second phase is coaching, great concern for both the people and the task, which is even while the director giving lots of instruction, the director will make an effort to understand the feelings of the employees. In the third phase, participating and supporting, little concern for the work and strong concern for the people, actively seeking for more responsibility for managing the hospital cases. Besides that, problem solving and decision making transfer from the leader to the follower. In the last phase is delegation. The director might scale back on their encouragement and assistance. Furthermore, followers are no longer depend on manager for guidance, and the entire delegation of the decision making to the follower.
Hi and Assalamualaikum. I'm Miss Zahra. For my part, I will be presenting about controlling. Controlling can be defined as a process which manages regulates organizational activities to make them consistent with expectations and help to achieve standards of performance. There are 2 important things in controlling, which is process of control and types of control. We go with process of control first. Process of control has 4 different steps. The first one is setting standard of performance. In this case, Harmony Specialist Hospital has various setting standards of performance, and one of them is financial stability. Financial stability is the standard that can be used by targeting a certain amount of budget per month for a company. The second one is measuring the actual performance. Harmony Specialist Hospital measures the actual performance by having financial reports, cost, and personnel observation. This helps to achieve the standards of performance that have been set by the organization. The third one is comparing actual performance with standards. This process means The financial manager of Harmony Specialist Hospital must ensure all the measurements in the actual performance are equal to the target budget that has been set in the standards of performance. And the last one is responding to deviations. This one is the process where the financial manager will choose to either take no corrective action or take corrective action. The manager will be take no corrective action if the deviations are acceptable or there are no deviations. The next slide is about types of control. It has 3 types of control, which is feed-forward control, concurrent control, and feedback control. The use of feed-forward control is when the health manager of Harmony Specialist Hospital in the pharmacy sector is sent to do a full inspection of the medicines before they buy from their suppliers, because they want to make sure the medicines are in excellent condition and sufficient. This function is desirable because it can help the manager to prevent problems from occurring beforehand. Then, the concurrent control can be used when patient care managers are in charge of supervising the clinical team. One of their duties is to look after the daily operation in clinical care unit to ensure smooth operation and services throughout the day. If the patients have medical problems or severe allergies, the patient care manager will take immediate action and find a solution without stopping or postponing any process. Last but not least is feedback control. Feedback control in this case is when the managers need to do a full inspection of the product. To determine the safety of the patients at Harmony Specialist Hospital, the chief pharmacist is responsible for ensuring the safety and conducting a quality check of the purchases like medicines, biological products, antibiotics, and other pharmaceutical products. The chief pharmacist also needs to do a final check and make sure all the medications meet the standards and specifications to avoid undesired effect happening to the patients. That's all from me. Thank you.
That's all from our group. Thank you.